I'd like to talk to you today about kinesio taping. It was developed over 30 years ago in Japan by Dr. Gasque, and we here at Helen Keller Hospital in rehab settings pretty much across the world use it for various different things, such as to reduce pain, to reduce swelling, to improve function, to inhibit muscles or facilitate muscles to perform an activity. We use it on all types of patients, pediatrics, our athletic patients, and our geriatric patients for a range of injuries. The tape itself has no medicine in it. It basically has a weave pattern and some tension built into the tape that mimics skin and fascia. And when applied appropriately, this weave pattern and tension try to break up the adhesions that form in the skin and the fascia when a patient suffers an injury, such as whether it's a specific injury, such as spraining an ankle, or if it's something that occurs over time from chronic use, or such as a surgery. It's very hypoallergenic. It's made out of cotton, and it's made to be worn 3 to 5 days. Some patients get a day or two wear out of it. Some patients have actually gotten a week or two wear out of it. And so today we're just going to show a couple common applications we use in the clinic. This is for somebody that would have a rotator cuff tendonitis or impingement of the shoulder. Process with inhibiting a muscle is you want to go from the opposite of the muscle fibers. So we're going to go what's called distal proximal. So applying the tape down, and for the real deltoid, bring the shoulder forward and put just a little tension on the tape. And then for the anterior, again, you're going to put on a little stretch and put a little tension on the tape. Activate the glue by rubbing it and getting it hot. A good one for a rotator cuff tendonitis and impingement is stabilization of the shoulder. Internally rotate their arm. Pull almost 50 to 75% on the tape, and then have them horizontally adduct their arm. So bring it across your body, and then just lay the tape fiber down. A lot of times the upper traps get real stiff and tight with shoulder pain. So another popular one is to come in and inhibit the shoulder, or inhibit the upper traps. Tilt your head to your right. There you go. And so going right along the muscle belly of the upper trap. Alright. Just to that's going to give the upper trap muscle a little feedback to relax and not pull on the neck and shoulder so much. It really helps to decrease the pain, and actually a lot of patients that say they can't sleep through the night due to shoulder pain, this helps out a lot. Next tip will be for lumbar strain or back pain or lumbar radiculopathy. Start right around the top of the sacrum. Anchor it down, provide just a little pull, and in the kinesio taping world, less is more. You don't have to have a lot of tension, about 25%. Roll it down, and then no tension on the end. Rub that here to the tape, and then same thing on the other side. As far as the length, this kind of determines where they're having their pain. You can actually go all the way up. Somebody that's having a lot of elbow tendonitis or tennis elbow, golfer's elbow, or swelling in their hand, this is a good hand one to do. Again, this is something that can be worn several days. You shower with it, bathe with it. It's actually pretty comfortable. Regular taping that you use, a lot of people are allergic to it, or has even the glue that they use on regular tape breaks people's skin out, and it's non-breathable and it does not give. Kinesio taping is very breathable. It's very porous, so it allows your skin to breathe. and the glue and the fabric itself is very hyperallergenic. Also, it's got a special design pattern on it and tension built into it that's supposed to mimic what's called your fascia, which outlines all our muscles in our system. And that tension in that specific pattern is supposed to break up adhesions in the muscle fibers and the fascia. As far as the different patterns, basic rule is if you want to facilitate a muscle, you go from the origin insertion, or in the kinesio taping where they call proximal to distal. If you want to inhibit a muscle, you go the opposite, you go distal to proximal. You're going against the muscle fibers to give a neurological cue to tell that muscle to relax. And with the swelling part, it actually goes to the lymph channels. So you're kind of taping along the lymph channels and lymph nodes. And the patterns themselves are just kind of up to the therapist and kind of experience. You can get creative with them. You can use what's called just eye strips, which are what we, just basic cut of the tape, where you can cut different patterns in the fabric to just make it look cool and neat for the athletes and kids and stuff. I actually tape a lot of pediatric patients. I've taped kids as young as 5 weeks old, and I tape a lot of kids now that are having problems because they walk on their toes. So facilitate them to get a heel strike while walking. We tape athletes with just common strains and sprains, surgical patients with excessive swelling, older patients with back injuries or neck injuries. You're kind of, again, going back to, you're limited to the imagination of the therapist, just knowing how the general anatomy of the body works to what you can come up with and tape. A lot of people are surprised you can put it on and then go take a shower, go swimming with it, or go run with it, and you can keep it on afterwards. I've actually had a lot of older patients try to compare it to duct tape, although it's definitely nothing like duct tape. But the amazing thing is a lot of patients will come in and call it magic tape because there is no medicine in it, and it's just kind of how the therapist puts it on and the pattern that's built into the tape that really does the effect for it.